From Oshkosh Community Media Services, this is Oshkosh City Cable 10 and broadcast on 101.9 FM WOCT Oshkosh.
The Oshkosh Senior Center presents Senior Savvy.
Hi, welcome to Senior Savvy. I'm Jane Wells, your host for today's show. Senior Savvy is brought to you by the Oshkosh Senior Center, where it's our mission to enrich the quality of lives for adults ages 50 and older. Over the next couple of months, you are going to see some changes in the format of Senior Savvy. While there will always be that informational or educational component to the show, we're also hoping to highlight some of the things that seniors in our community are doing. So we're going to do a little bit of that later today. But first, something I've been pondering. Have you ever really missed someone, kind of wondered whatever happened to them? Where are they? Where did they go? Well, in case you're missing this certain individual who's very notable around the center, Mr. Bob Cornell, Bob has been such a great supporter of Senior Savvy, and Bob is out for a little R&R, and that's actually rebuild and rehabilitation. So Bob is the president of our advisory board and is just very active throughout the center and involved in a lot of the programs. So Bob, we wish you well. We're thinking of you, speedy recovery, and we're anxious to see you back at the center again, and we're missing you. So God bless. So today's show, I would like to introduce a coworker of mine who is new to the Senior Center, and her name is Paula Seeley. Hello, Paula.
Hey, nice to be here.
Great. So why don't you tell us just a little bit about yourself and some of the personal stuff?
Personal. My name is Paula Seeley. I was born and raised in Fort Atkinson, home of the Fireside, which many seniors know about.
Yes.
I went up to Alaska my last year of college because I needed money, and went up there and gutted fish for a year, paid for the rest of my schooling, and lived up there, fell in love with the place and fell in love with a man up there, and stayed up there 15 years. We came back here to finish some postgraduate schooling, and when we arrived down here, we were planning to move back up to Alaska, but lo and behold, I got pregnant for my firstborn, Olivia. So we just fell into Oshkosh and fell into the lives here, and I worked at Old Mercy Medical. I worked at St. Luke's in Milwaukee. I worked for Old LaSalle Clinic that was here. And so I've kind of dabbled in a lot of different areas of medicine, and got welcomed into the Senior Center through Mark Zemer. So
Great.
Yeah.
And we're going to talk a little bit more about your role at the Senior Center. But first, there have been a lot of staff changes at the Senior Center, and it might be a bit confusing for people. So Paula and I came up with this little thing that hopefully is going to help clarify it for everyone. So, or so we say, right?
Yes.
All right. So to begin with, let's see. Paula
Stevens,
who was our nurse, has retired and is off enjoying retirement. But Paula was replaced with
Paula Seeley, which is me.
Exactly. So
Confusing. Different hair color, but same initials, PS and PS.
Exactly, so Paula and Paula. All right, and then we have Judy, who went on to retirement and is enjoying that very much, who was the activities coordinator, and Judy was replaced with
Jane, so a J and J.
Yep, Judy, Jane, Paula, Paula.
Yep.
That's the easy part, okay? So then at the Oshkosh Senior Center, we have the, the South Building.
And the North Building.
And the North Building. Now, you all know Sarah, who was in the South Building, but now is in the North Building. Okay. And Jane, who was in the North Building. But now will be moving to the South Building. Okay. And then we also had to say goodbye to Nancy, who has moved on to other things, but we did get to welcome back Kathy. Or we get to welcome Kathy. She's actually new to the center.
We say hello to Kathy.
Okay.
Yeah.
Hope this is clearing this all up for you, right? All right. So then you might say, well, that doesn't cover it all, because then there's Amanda.
And Carrie.
And where are they? Well, Amanda will be is out on maternity leave, and Carrie is soon to be out on maternity leave. So Carrie and Amanda are out for right now. Paula and Jane are in.
Yes.
And the buildings you'll have to figure out on your own and call, because that's the clearest thing we can tell you. Hope we straightened that all up for you and made it just crystal clear who's who and where everyone is.
Yes. Yes, Paula, it's made it very easy for transition.
Yeah, exactly.
At least there's no name change. It helps with memory.
There you go, exactly. So that was just a little fun thing we wanted to do. All right. So Miss Seeley, what exactly is your role and your title at the Oshkosh Senior Center?
Presently, they gave me health project manager. I work 11 hours a week, which is a change in hours from where Paula Stevens was.
Exactly.
Yeah.
So do you have a set schedule or just...
I do have. Currently I've been doing Mondays and Wednesdays, usually in there at 8 and usually home by about 1. I do kind of, flex my schedule to, attend Parkinson's support and to do some different meetings that I'm needed to do. So I'm flexible, but Monday and Wednesday is what I've tried to be a little bit more, meaningful.
Sure. And like you said, that is a change from what Paula Stevens had worked. And so,
Yeah.
But your job is not the same.
No. I come from a nursing background, so I have some of the flow of what the nursing duties were at the senior center. Most of the health project manager, what they've wanted to see is more connections. Where's the common threads between some of the programming here, and where can we utilize those threads so that more people can be involved? Or cost savings, which is always a big thing. Can you thread together different support groups that you're utilizing a lot of the same facilities and a lot of the same speakers coming in so that it's a little bit, more flow.
Right. So it's kind of as if you're building a curriculum per se, and you're building it one on top of the other so that, like you said, there's some continuity and the best use of the resources that we have.
Right.
Exactly.
Right.
So your role in all of that is to help facilitate that and to
Right.
make that happen and to look at areas that I think it's always easier for somebody coming in from the outside to
Right.
have that more objective view and say, hey, did you guys ever think about
Right.
putting A and B together?
Right.
And, oh, gee,
Right.
there we go.
Well, I have a lot of connections still through the university from attending college there. I have good threads into Fox Valley Tech, which they bring in a lot of different medical and health programs, and I think there's a lot of utility value there.
Right.
Just using some of their knowledge that could come into through the senior center. So
Right, exactly. Again, it's all that connecting. Let's see. So let's talk a little bit about the nail care, because that's a big component of what happens in terms of the health field at the senior center. So tell us a little bit about that.
Well, Paula Stevens' program that she had there, she individually gave nail care to people. And some people think, ooh, nail care kind of icky. Nail care really good. With age, your nails get a little bit more brittle, your circulation changes a little bit. It's harder to see and bend to get into, to do your own
Right.
toenails, and it's not so fun sometimes.
Right.
So Paula brought into that program into Oshkosh Senior Center, did a great thing. Changing over is difficult. Different people coming in, different fields, different conversation. We have Becky from the Valley Visiting Nurses Association, sometimes called Valley VNA for the shorts.
Sure.
And she brings in another thread where back when Paula was doing nail care, people and seniors did their nail soaking at home. Becky does your soaking through the Oshkosh Senior Center to prep for her next. That's the way Valley VNA works.
Sure.
So I think there's a lot of things that we bounced off, as a senior center. We're making the room a little bit more spa-like.
Yes, that's our goal,
Yes,
isn't it? You and I have actually been taking on that project.
Yeah.
And of course, our goal is that, people with common issues might have a chance to chat with somebody else who has some of the same issues and yet still respect their privacy and yet be able to
Right.
have an opportunity for them to relax, to chat with another person who has something in common with them, and then also to have some literature available for them from an educational aspect and
Right.
things like that. So,
Right. And I think that whole feeling like you're not just going in and this is what's happening. And, I think those pieces with Paula, it's hard to let threads go because you've had conversation for 20 years
sure.
now.
Exactly.
And I think I think it brings conversation back in. in. I think it brings that community feel back in, that, you know, there's more connectedness there. I think the nail care can only get better. I think there's a lot of different things we've thought of for the room. It's not just going to be the nail care room. There's other things that we can bring in, you know, massage. I think there's a lot of different venues we can go. In the nail care, because of circulation, Becky does do a foot massage after. She does assess skin to make sure everything looks good, and if something needs to be looked at further, she does refer. But it's a nice process, and I think the process, you know, has really, really grown, even in the couple months that the changeover has occurred. But I think it's good. Change is hard, but change is good.
Right, and I was misinformed or under the misimpression that it was only for people who had diabetes. For some reason that was in my head, but that's not the case at all.
No,
is it?
Anybody can come. It's if you're over 50, because we're at the senior center, anybody can come. You call in for appointment through Sarah Barrett. Through the senior center. She'll make you an appointment. They're very easy to slip into. We have morning appointments as well as some going into the early afternoon, so we can fix with schedules and stuff. So no, everybody's welcome.
Right, and different days of the week too.
Right.
Correct. It's not always just a Monday morning and that's it.
Right. Right.
So, and again, so if they would like to schedule an appointment, they should call Sarah.
Sarah. Yeah.
Yep. And I think she's 232-5310.
Yes.
Is her extension.
That sounds correct.
Exactly.
With my great memory for numbers.
And Sarah is wonderful on the phone, and she'll get people set up into a time slot that works for them.
And it's all by comfort. I mean, if the soaking sounds kind of freaky and it doesn't sound comfortable for you, you're not forced into doing things that are not comfortable for you. But you know, it's available for those that want it, and most people have opted to have the soak and the foot massage after.
Exactly.
So, yeah.
And along that same line, we are looking for volunteers who would be willing to help work in that spa room, and just to be a welcoming face for people who come in and offer a little hospitality. So if somebody out there has an interest in volunteering in that role, please give us a call at 232-5306.
Right.
So just had to put that plug in quick for that volunteer need.
It's a good, and we named it, and I want to say we were coming up with different names. It is an assistant. There are some different medical things that we're looking at as far as you know, that volunteer could also flow into when we are having health clinics going on. We have a skin assessment coming up, and it's just greeting people, leading people, and working with the medical people, which is kind of fun sometimes. It's a great place to learn.
Yeah, exactly. Good. Okay, so September is also Falls Prevention Month, isn't it?
Fall into fall.
Exactly.
Yeah.
And falls for seniors is a pretty serious issue.
Yes. Statistics show in the United States, 1 out of 3 people that are over 65 will fall. That's just a known national statistic. So it's there. The injury pattern after is whatever your age is, whatever your physical ailments are. So, you know, big questions are, why do falls occur?
Right.
I mean, there's many, many different whys. Certain medical problems can be part of it, heart rate changes, something called postural hypotension.
And I just learned what that actually is.
Yes. So that's when your blood pressure changes. Your blood pressure is at a certain, when you're laying or when you're sitting, your blood pressure is at a certain number. When you stand up, sometimes your blood pressure drops quickly.
Right.
You get a little bit lightheaded. Some people can even get the sparkly feelings in front of their eyes. Some postural hypotension is caused by different medical conditions. Some of it's from having a low blood pressure. It's a very, very common cause for falls.
Sure. So if somebody is experiencing that, should they talk to their doctor about it?
Yes.
Because like you said, that is one of the things that leads to people losing their balance, because you get up and you're not sure where you're at, really.
And it's really easy. It's a non-invasive thing. The blood pressure goes on, cuff goes on. You have your blood pressure checked when you're laying, standing, and sitting. So very, very easy to check for that. Sometimes it's just changing, how you're drinking during the day. Some of it is being more aware. So if you do have postural hypotension, what you need to do is to rise up slowly and change. And a lot of times with falls, it's that quick rush. All of a sudden the phone rings.
Right.
And it's bam, up you're going to catch that phone.
Right.
So preventative thing is to have the phone next to you. But running to the bathroom, another urgent, urgent problem for people. It's, oh my gosh, I really got to go, and bam, you're standing up too fast, you get lightheaded. or you're shuffling too quickly to the bathroom, you trip over maybe a rug on the way,
Right.
and the fall occurs.
Right.
So the medical conditions, vision changing. With older people, a lot of times you do get some cataracts, some visual changes, and that makes a difference. That you do need to have your vision checked once a year by a professional.
Right. Exactly.
Yeah.
So.
Yep. Go ahead.
I was just at a conference, and a lot of this is still a learning curve for me because I was in the role of volunteer coordinator.
Right.
So I didn't necessarily know all of the other aspects that go into it, but a pharmacist coming into the center to
Yes.
talk about medications, I didn't realize how much medications can impact a person's propensity to fall.
Right. Medications, over-the-counter medications, herbal medications can affect your balancing. We do have a pharmacist that comes to the senior center once a month, and you can look on your programs to find out when he's there. He happens to be there during one of our falls prevention clinics that are coming up.
So would that be that connectivity thing that you were talking about earlier?
That is the connectivity thing. This is how the first connection started.
Exactly.
So it's a great resource. You don't have to come for the falls prevention class to talk with him. You can bring your list of medications in and talk to him anytime. It's a great service. He's a great person, and he has lots of time to talk. It's not feeling rushed at the counter. He's sitting, he's available, it's privately done.
Right.
So it's a really, really significant service, because a lot of times when you're at the pharmacy, your pharmacist is looking, these are your prescription medications, but they don't include maybe that Sudafed you take, or maybe the cough syrup that you're taking. So it's really nice to have those.
So not only bring in your list of your prescription medications, but anything over the counter you're taking as well.
Or may want to take. Maybe during cold season you need to take this, bring it in, have them look at it and tell you, know.
And when you're at the pharmacy itself, and there's 5 people waiting in line behind you, I don't know about anybody else, but I always feel pressured to, not ask a million questions. And so that's a more relaxing environment where, and you're one-on-one, and you can get clarity and really write down what he's telling you to do. So we talked about that being during the falls prevention program. So let's talk a little bit about that.
Right. Falls prevention, September 19th. Barb Wolf, who is a public health nurse and an RN from Winnebago County Health Department, is coming in to do an overview of her preventative programs and measures you can take to prevent falls. Winnebago County has a really nice website that you can take a self-assessment test on to find out what's your propensity for falling. Do you have significant medications you're on, or certain things going on in your life that you can do kind of a quick yes and no and see if you are at risk.
I was going to say, what are some of the things, or an example of some of the things that are on there?
Most of it's like what we talked about. It's the vision, it's the some of it's layout of your your house itself. Are your floors looking are you a little bit more cluttered because you can't help pick up anymore? It's hard to get down.
Or you have a lot of kids living in your home, and
that sometimes, or a lot of grandchildren visiting. Yes, exactly. There's a lot of that stuff in there. And some of it, when you get older, or if you lose a spouse, you lose some height.
Yes.
And so when you're reaching for things is a really dangerous thing, because all of a sudden you're sliding over the step stool that might be a little bit not so sturdy, not so stable, and you're reaching up, and sometimes you just need someone to assist you in moving the things you use most often into a lower area so you're not overreaching. So there's a lot of really good things, a lot of really good tips that you can quick pick up for falls prevention to prevent that fall. They also go in falls prevention. We also go through safety nets. A lot of people don't like to wear a lifeline, but when you fall, and if you don't have like a neighborhood check or someone checking on you on a daily basis, that lifeline can be very, very effective. My mother hated wearing hers. She was nervous to press it. She was nervous that she was going to press it by accident. They rather have you pressing by accident and just giving you a quick call and say, is everything okay? Than having someone laying on the ground for 2 and 3 days without being found.
Exactly.
So,
Yeah. So again, they can go to the Winnebago County website, correct, to find that for the facts on falls. And that is www.co.winnebago.gov. wi.us, and they have the self-assessment check and just kind of like a home screening things to watch for within your home. And like you said, I never even thought about the whole reaching factor and how many times have we grabbed that little swivel stool on rollers and stood on it.
Guilty.
Yes, exactly.
Yeah. And the other thing Winnebago County does offer is they do offer a free in-home risk assessment performed by one of the public health nurses. Okay. So it's a nice program that they have available. And again, Barb Wolf is coming to the Senior Center to do like an hour programming. It just so happens that the pharmacist is there at the same time. Perfect. In case you'd like to speak with him at the same time. We're hoping he'll do like maybe a 15-minute presentation at the end on common medications that cause falls, or that can cause imbalance problems.
Like dizziness and stuff, sure. Yeah. All right, so real quickly, let's talk about the upcoming flu clinic dates, because we have some of those opportunities for people to come into the Senior Center and get a flu shot.
Right. Flu clinic flu season comes up quickly. The first clinics for Senior Center, it's a little bit more expanded clinics this year. It's more inclusive. It's going to be the first 4 Wednesdays in October, which would be October 2nd, 9th, 16th, and the 23rd. Right. Presently, those clinics are open from 9 to 12. We're still trying to figure out schedules right now, so there might be an afternoon appointments coming in. And as far as scheduling appointments, we'll have you call, and I'm trying to think if we...
Just the general number.
General number.
232-5300. And who's giving the flu shots, or who's doing that part?
Yes. Again, Valley Visiting Nurses Association. They've been... We've shifted over from the nurse from the Senior Center doing it to Valley VNA because of the billing. The billing's much easier through the Medicare and any supplemental insurance you might have. It just, they're very good at doing this, and it makes the flow much easier. And they're quick. I mean, it's a quick, and hopefully we'll have some music playing, so where you're waiting that 15 minutes after you're getting your flu.
And drinking your little juice.
That's right.
Exactly.
And they're offering Pneumovax too this year too, in case you need to be caught up.
Okay.
So.
And then September is a very busy month. It's also National Preparedness Month. Yes. And what does that mean?
Be prepared.
Exactly.
Be prepared for, it can be an environmental thing, the hurricanes, the tornadoes. In Wisconsin, I feel it's more the quick outage, the quick power outage because the snow, the ice, that you're stuck in your home for a little bit of time without having access to people. We had the floods a couple years ago. Right, exactly. And it really shuts yourself down, so the preparedness is...
Right, and recently we just had the area without electricity for 2 or 3 days.
Right.
And that's really what this is kind of about, is preparing yourself, having a little stash of stuff, basically, that you could get through 2 or 3 days without having to go to the store or without having to run out of your medications and things like that. Yeah. So we do have a video to show that's in promotion of National Preparedness Month. And this video is specifically targeted for seniors and how, as a senior, to best prepare yourself and some of the things that you should have tucked away in your emergency kit or your emergency box and things like that. So we're going to go into that video in just a moment. It's a like, why should I be prepared? And yet,
yes, things happen, and unexpectedly. I mean, you can listen to the weather, listen to this, but things happen quickly. Right. And it's really nice to have a little stash. Including chocolates if you need them. But
by all means, exactly.
Yes, but just enough of a stash to keep you healthy and safe for a couple days until everything can, come into your house again.
Right, and until stores and whatnot all reopen.
Right.
And you know what? You might have it packed and never have to use it. And wouldn't that be great?
Yes.
But just in case, it's probably best to be prepared.
Yeah.
So hopefully this video will give you some information that you need and a little bit of insight. And you can always go to ready.gov is the website that also has more information on it. So at this time, we're going to roll into the video about preparedness for seniors.
Being prepared for an emergency is important at every age. As an older American, you may need to think about taking some specific steps as you get yourself prepared in case of a disaster.
As people age, their needs change and their capabilities change. So in preparing for a disaster, it's important to think differently than you might have at earlier ages. Preparing for an emergency is very empowering for older adults because it gives them the opportunity to identify what they need and ensure that they'll have those needs met when a disaster strikes.
Take a few minutes to check out the Ready.gov website, which features specific tips and tools for older Americans. There are a few basics. First, learn about the types of risks that could affect your area. Then, make a plan. You can use the Family Emergency Plan available on Ready.gov to organize and help you develop a plan that works for you. Create a personal support network if you need special assistance during an emergency.
A personal support network is very important for all Americans, but especially for older Americans. It can include your family, friends, neighbors, doctors, organizations, places where you worship, places where you do activities, and just making sure that those people know what your needs are in case of a disaster.
Let the people in your personal support network know what medicines you rely on and if you have any physical limitations.
For older Americans who receive services such as home health care or receive regular medical treatments, it's important to reach out to those service providers ahead of time and communicate to them what your needs are, and also to understand what their emergency plans are in case of a disaster.
Identify someone locally and someone out of state who will be your contact person in case of an emergency, and learn how to send updates via text messaging to your friends and family.
One of the things that we've noticed in the past during major emergencies, both the regular phone lines as well as the cell phone lines were overwhelmed. But people were still able to text message vital pieces of information in terms of location, nature of problem, or just to text to say all is well.
Once you have a plan, prepare an emergency kit. A standard emergency kit includes food, water, and medicine to sustain all members of your household for at least 3 days. Visit Ready.gov for a complete list of suggested items, along with recommendations for how to prepare a family emergency plan. Pay particular attention to certain things, like making sure you have enough of any medications you take, an extra pair of glasses in case one breaks, or extra batteries for hearing aids.
It's important to remember that certain things such as medicines can go bad and spoil, so just make sure that what you're putting into your kit is not expired and check it on a regular basis.
If you are unable to obtain an emergency supply, be sure to always fill your prescriptions on the first day you become eligible for a refill, rather than waiting until the day you run out. Keep copies of important documents like birth certificates, insurance policies, Medicare cards, and financial forms in your emergency supply kit. Also consider placing electronic copies of this information on a portable flash drive. This could be useful for others even if you don't personally use a computer. For those who depend on the mail for their Social Security benefits, switching to electronic payments is one simple, significant way people can protect themselves financially before disaster strikes. Federal benefit recipients can sign up by calling 800-333-1795 or at www.godirect.org. A disaster can occur at any moment. By making the commitment to prepare yourself ahead of time, you'll have the peace of mind and confidence needed to get through any emergency situation. Check out the information for older Americans on Ready.gov and get started preparing today.
So I hope that information presented in that video was of value to you. Next, I would like to highlight some really neat things that some people within the Oshkosh Senior Center are doing. We have a group called Wisconsin Warmers, and they make quilts. And Cheryl Clemmer, who is leading the Wisconsin Warmers, has partnered with Habitat for Humanity. And Cheryl and her group of volunteers make beautiful quilts for people who are receiving a Habitat home. And I was fortunate enough to be at the latest home presentation where they had a quilt for every member of the family, and they call and they get information on the family, and so the quilts are kind of custom made. They're made towards interests or towards gender, and it's just a wonderful thing to be a part of. So hats off to Cheryl and her crew for doing that. It's just fabulous. I would also like to highlight a young man by the name of Gene Kreitzberg, and Gene has just completed his 500th quilt. He didn't start sewing until after retirement, so it just shows you that you're never too old to learn something. So congratulations to Gene and to Wisconsin Warmers. Thank you for watching Senior Savvy on City Cable Channel 10 or for listening on 101.9 WOCT. You can also check us out on YouTube. We are there as well. Thank you.